Hi, and welcome to Focus on Health. I'm Jay Cohen. I'm the branch director at the Winsted YMCA, part of the Northwestern Connecticut YMCA, and we're happy to have you with us. We're now on our 5th episode. We're into a great groove here. We're moving right along, and for those who have been following the show, and you can tell by our name, we talk about health-related issues in the greater Winsted community. We bring on different individuals, organizations, families, initiatives that are doing something unique and exciting to improve the overall health for our greater community. And tonight's going to be no different. We've got a great guest, Tim LeBouthier, who's the Director of Community and Public Relations for Charlotte Hungerford Hospital, right down the road in Torrington. But obviously they cover the whole region. We work closely with them at all of our branches, including here in Winsted. And of course, you can't get an organization that does more with health than a hospital. So I'm sure we're going to have a great conversation tonight. So Tim, welcome to the show, and thanks for joining me tonight.
Thanks for having me. This is really kind of fun. I'm enjoying this so far.
Excellent, excellent. Now, an organization as large as Charlotte's obviously got many different programs that are focusing on health. So what's one you think we should really know about?
Well, springtime is always kind of a time when we try to do a lot of programming because people are kind of they're kind of anxious to get out now that the winter is kind of being put to bed. So we do a lot of free programming actually, and we have those throughout the community. Sometimes they're in Winsted, sometimes they're in Torrington, and so we try to focus on kind of what people are thinking, what's out there. During May, we have stroke awareness. We're going to be doing a lot with nutrition. Coming up this spring, we've got a few talks I'll mention, and then of course we do our Cancer Survivors Day, and then in August we always like to mention that we do our Center for Cancer Care also has their big the Tour of the Litchfield Hills, so that's for walkers, for cyclists, and that's a big event. You can go up to 100 miles with that. And they raise money for the Cancer Center. So this is the time of year when we try to get everybody to think about their health and certainly come on out and attend some of these free events. So.
And I would think a lot of people don't associate those type of events with the hospital. They think, all right, when I get sick, I go to the hospital. But I know a big focus, especially of what you do, is helping people stay well before they get sick.
Exactly.
And so they don't realize that there's this whole preventative medicine on the side of the hospital.
Whenever I see folks in town or in the community, I always say, I hope to see you soon, but I don't want to see you at work. And so, we really do try to provide, assistance and just kind of some different programming for people in our community, so they can live healthy and understand that. Some of the things that they do, their lifestyle, it's about making, good choices when it comes to nutrition and to exercise. And so if we can be out here telling folks, and kind of, being out here and doing that, that's kind of what part of our mission is. So that's what I'm going to do that too. So, but what I'd like to kind of talk about is a little bit about the community health needs assessment that we did, and the YMCA was all part of that. And so Charlotte Hungerford Hospital and the YMCA and the United Way, the Department of Public Health and Torrington Area Health Foundation all got together and they commissioned a health assessment. And this is really something that many of these organizations have been doing individually, but we got together and we did a comprehensive study, and we learned a lot about the eating habits and the health habits and all the different types of kind of statistics that we use as professionals in the community to see where we can improve, where we can get the public to kind of focus on when it comes to their health. So it was really very interesting, and there's a lot of good news in the report. And what we did was we put the report online. It's at the Torrington Area Health District's website, and you can take a look at it there. But there's some good news. For instance, smoking. If we take smoking, in Connecticut, the amount of people who have given up smoking over the last 20 years has declined 40%. So it's good. I should say smoking is down. Those that have decided to quit are up. When it comes to junior high, middle school kids, it's 66% down, and 40% with our high school students. So they're getting the message. We're getting the message that smoking is not a healthy thing to do.
That's a big turn.
And, it's a big turn. It's a big turn.
And now we need to take that what we've learned from those methods and strategies and apply that to the other health areas like the obesity epidemic, and,
Exactly.
and if we can kind of turn that curve in the same way using some of those same strategies, that would be huge.
So one of the things that we're doing, for instance, this year, Charlotte had offered our smoking cessation program for free to anyone who'd like to do it. And it's normally a $75 class. So this was, we had over 20 people that graduated this first session that we had this earlier this year, and we have another one starting this month. So I encourage everyone who has been thinking about quitting smoking, and whether finances are an issue, or whether you're just looking for a program that may be accessible to you in your town, please give us a call, or it's all on our website, charlottehungerford.org.
Speaking of giving a call, I want to let everyone
we
know.
have a call?
No, well, we don't have a call yet. I'm actually going to open up the phone lines. If you're watching us
Yeah, throw some
live,
ideas,
and we do this live on Mondays at 6:30. And we'd love to hear from you. If you have questions or comments, we'd love to have you join us. And the number's right there on the screen, 238-7518. So give us a call, and we look forward to talking to you. But to return.
So we also put together a smoking support group, and that's something that we've wanted to do for a long time. And this is open to anyone who's a former smoker, and we know how hard it is to kind of continue to be smoke-free. So they meet on the first Wednesdays of the month at Charlotte, and it's really a great group. And they have special speakers, and they talk about the different dieting techniques and different ways in which you can make sure that you live a smoke-free life after you quit. So
I think the support can be a huge part of it.
It really does, and for anyone who's involved with any kind of support group for any health reason or otherwise, it's good to be with people that are experiencing the same thing that you
Sure.
are, and so we've seen that. But you see, I have a little plate here. This is My Plate. Right here, look in the camera. Yeah, there it is. This is the My Plate, and so when we talk about good nutrition, we meet with people and we have talks. This is actually new. I remember for those of us who are a little older, you probably remember the pyramid, which used to kind of give us this idea on what are the healthy things we should be eating.
Right.
So they've replaced it with the plate. You can go to myplate.gov, and this is really what you should have on your plate on a daily basis. So fruits, grains, proteins, vegetables, and so we take this
no
around.
candy section anymore?
There's nothing. Yeah, there's no little extra down here for that. And of course, switch to fat-free or low-fat milk and other dairy products. And Eat Smart, Good Nutrition starts with My Plate. And as I said, the government. You may have seen Michelle Obama's initiative as well, and the folks at the Y have great nutrition programs. And so this is really kind of where we start. And we go into the schools and we talk to the different kids, and I think that our local schools have done a fantastic job with the kids, because it seems like when I'm having this at the marketplace where I bring this up, people know, they understand the plates, they understand good nutrition, they understand that they should be drinking water. So I think that we've really started in our school systems a great dialogue with the kids. And so we need to support them in our own. So one of the things that we've been trying to do is to fight the childhood obesity epidemic. And although the obesity and the smoking rates in our area do exceed the state averages, we've made a lot of headway with smoking. Obesity is a little different. Our survey said that 50% of the kids score below average, a state average on our physical activity tests, our standardized tests that we do in schools. So we need to get the kids out there doing a little more physical activities. And so the study also showed that there are adequate resources and different programs within the community for families and kids to do activities. We just got to get them out there to do it. So they can come to the Y and do swimming lessons, or they can be walking on many of our trails. There's all kinds of sports teams, soccer and whatnot. And then, of course, there's talks as well. So we want to try to educate folks. We're actually having a talk coming up Thursday, April 11th, which at Charlotte. And again, it's all on our website, but it's going to be Facts in Food, Understanding Diet and Healthy Nutritional Practices. And this is going to be done by Dr. Meltzer, who works up at our medical walk-in on East Main Street, and then also Carla Angevine, who is our registered dietitian at the hospital. So they're coming together, and they do a great program. They've done this before, and we're going to be having them talk about different types of nutrition and things to good thing for families and parents. So for families and parents and kids are welcome as well. You're encouraged to come to these free talks and kind of learn about the effects of junk food and high sugar drinks and things. And you go to one of these talks and you realize it's very easy to change your lifestyle if you're committed to it and you understand what these are doing to you. So.
Yeah. Well, there's certainly a lot of barriers or just disincentives. Everywhere you turn, there's the fast food or even if you want to walk places, it's not always an option. But you mentioned the trails, so more ways for people to actually walk or bike places is huge. Just enabling those healthy options. So like you said, making those choices. When you can make the choices easier, that's huge.
Yeah, and that's really the responsibility of all of us. Not only for our own health, but for the health of the children in our community. And as I said, the programs that you have at the Y, that's really kind of a good start.
Yeah.
And so we try to educate, and there's so many resources out there as well. But I would start with myplate.gov. It's really a great website, and there's all kinds of resource materials. You can get coloring books for the kids and all kinds of different
Will they actually send you a free plate?
Actually, they don't. I had to actually buy this. It was a couple dollars, but
it's a good investment.
So it is a good investment. It's great to just have it around, and I take this wherever I go because I like to kind of pull it out and say, are you eating a variety of veggies, especially dark green, red, and orange ones? Because I guess those are the colors.
It's a good conversation starter. Actually, when we had Art Laney on, the food services director last week, he was saying that the school menu requirements actually call out colors. They say you must have orange food so often and green food so often on the menu.
That's what this says. I was surprised to see that. So peppers and orange and then seafood 2 times a week, lean meats and poultry, beans and peas, soy products, eggs, and unsalted nuts and seeds. Some of the different things for protein. I don't see a big steak on there. That's just talking about lean meats and poultry and seafood. And also, of course, fruits, frozen, canned, whatever. But try to get the fruits without the added sugar. And then, of course, refined grain foods and whole grain foods, too. So it's really... we could spend a lot of time, more than a half hour on that, but it's great. So I encourage folks to come and join us at these free talks because they really do give great ideas. Not only do you learn about the foods that you're eating, but you get some good ideas on where to get healthy recipes and things like that. So
now. I know a lot of this happens at your Torrington facility, but you also you branch out into all the a number of different communities. So what are some other ways that you touch the communities?
We do have Charlotte is kind of a healthcare system in the fact that we do have all different types of services throughout the community, including here in Winsted. So we have our operations at 115 Spencer Street. And there we have an emergency room, but we also do mammography there. There's also blood drawing. We have our cardiac and pulmonary rehab there as well in Winsted and Torrington. And then we also have a sleep lab, which not many folks know.